Morning, we're going to talk about a topic called inhaled combined budesonide formoterol as needed in mild asthma. To start, we're going to give information of the presenter, Stefano Budesonide, and we're going to give an introduction of this topic for and about mild asthma and combined therapy. So we can say that mild asthma, which can be well controlled either with reliever medications such as short-acting beta-2 agonists or called also as SABAs, used all alone as needed or with low-dose inhaled glucocorticoid or leukotriene receptor antagonist used as maintenance controller medication, occurs in approximately 50 to 75% of patients with asthma. Symptoms may not necessarily be burdensome, but airway inflammation is usually present. Patients with mild asthma remain at risk for severe exacerbations and asthma-related deaths. Guidelines recommend that most adults and adolescents with asthma use regular daily low-dose inhaled glucocorticoids as maintenance treatment to reduce airway inflammations, symptoms, and the risk of exacerbations. There's a video that explains the pathophysiology of asthma.
In a healthy person, respiration occurs as air goes in through the nose or the mouth to the pharynx and the larynx. From there, it goes to the trachea that branches into bronchi, then bronchioles, then to round sacs called alveoli, where gas exchange takes place. In a person suffering from asthma, the airways become inflamed and swollen, and the muscle bands surrounding them constrict. This prevents the movement of air to and from the alveoli. There are two different ways in which asthma can affect health. There is intrinsic, or non-intrinsic.
So we're going to refer about causes of using combined therapy. The causes of using combined therapy, or the reasons of using combined therapy, includes poor adherence to asthma medication, inhaled glucocorticoids as maintenance therapy, the use of only SABAs for symptom relief, and increase of use of SABAs is associated with higher exacerbation risk. We can say pros and cons of this topic. We can say the pros is that the use of a combination of a fast-acting beta-2 agonist and an inhaled glucocorticoid for maintenance, avoiding the excessive use of beta-2 agonist that could complicate asthma exacerbations, reducing the dose of each medication to prevent adverse events, and better adherence of medication for the patients. There's also cons. Cons include cost benefits of each medication may vary because of socioeconomical status. Maintenance therapy has no benefit over the use of only glucocorticoids. There's a possibility of low adherence to treatment in the meantime. There's a video that refers about other risk factors to acquire asthma.
My name is John Balms. I'm a physician scientist at the University of California, San Francisco, and also at the University of California, Berkeley School of Public Health. Asthma is a classic gene by environment disease, and there are multiple environmental risk factors in addition to heredity that can influence risk of asthma and risk of exacerbations of asthma. And this slide shows many of those. In the far left corner, you see individual characteristics like age, sex, race, and genes. And then around to the right, various exposures such as tobacco smoke, outdoor and indoor air pollution, infection.
To give some recommendations of treatment, there's also a video that explains benefits in the studies that they have other people made of using inhalers in combination.
This is Jeffrey Drazen for the New England Journal of Medicine. Approximately half of patients with asthma have mild disease. Of these patients, some are treated with short-acting beta agonists, which we call SABAs, only when they have asthma symptoms, while others are treated with inhaled glucocorticoids, which we call ICS, every day without regard to asthma symptoms. Is there another approach to treatment of these patients? The Sigma-1 trial was designed to compare the number of well-controlled asthma weeks, a composite measure of asthma burden, among various regimens used to treat mild asthma. The trial enrolled just under 4,000 patients with mild asthma who were randomized to one of 3 inhaled treatment arms: twice-daily placebo plus as-needed SABA, which we call as-needed SABA, twice-daily placebo plus as-needed ICS, and a long-acting beta agonist in a single inhaler, which we call as-needed combination, or twice-daily ICS plus an as-needed SABA, which we call ICS maintenance. After a year of treatment, the percentage of well-controlled asthma weeks was 34.4% for as-needed combination, as compared with 31.1% for as-needed SABA and 44.4% for ICS maintenance. The as-needed combination was superior to as-needed SABA, but inferior to ICS maintenance.
We can refer it as an issue in Ecuador, of course, because in Ecuador exists a big amount of people who use an inhaler with only one component of the combination, or it's SABA or corticoids. And the other high amount of the population use the combined therapy, which is more beneficial according to the studies. And most of this problem is related to the adherence of treatment and socioeconomical status. And the other factor is related to repetitive allergic processes that make the treatment incomplete. We can conclude that with this study, the budesonide and formoterol used as needed was superior to the SABA, considered as terbutaline, used as needed both for asthma symptom control and for reducing the risk of asthma exacerbations among patients with physician-assessed mild asthma. Furthermore, budesonide formoterol used as needed was inferior to budesonide maintenance therapy with regard to electronically recorded weeks with well-controlled asthma, but was similar to budesonide maintenance therapy in reducing the risk of asthma exacerbations at a substantially lower total glucocorticoid load, and without the need for adherence to a twice-daily maintenance therapy schedule.